Hello, my name is Bob Smallridge. I'm the president of the American Thyroid Association. I also work for Mayo Clinic in Florida, where I am an endocrinologist and the deputy director of the Mayo Clinic Cancer Center. My practice is devoted almost exclusively to thyroid cancer. I'd like to welcome you to the American Thyroid Association's video that has been prepared on anaplastic thyroid carcinoma. This disease is a rare form of thyroid cancer, but it is a deadly form. When patients get this disorder, the life expectancy is measured in months, no more than 4 to 6 months without treatment. And almost all patients do eventually succumb to the disease. The problem we face is that because it's so rare and so aggressive, we have difficulty identifying new treatments that will be effective in containing the disorder and hopefully eventually curing it. Therefore, it is very important that we continue doing research in this area, both in the laboratory and clinical trials, to identify better ways of helping our patients with anaplastic thyroid cancer. I'd now like to move to the video, which is going to highlight some of the challenges which we have at the American Thyroid Association and how our organization endeavors to meet some of those challenges.
Hello, my name is Manisha Shah. I'm the medical oncologist at the Ohio State University Comprehensive Cancer Center. I'm also an American Thyroid Association member, and I was involved in American Thyroid Association ATC and MTC guidelines over the last few years. I would like to focus on anaplastic thyroid cancer. It's one of the most aggressive solid tumors there is. And that's because we see it grow in days or weeks rather than months or years or decades. It causes devastating effect on patient and family who are struck with this illness. As a medical oncologist, we face these challenges every day in the clinic. Today, I would like to introduce a family member of anaplastic thyroid cancer patient. Her name is Mary Catherine Petermann, and her father has been diagnosed with anaplastic thyroid cancer about 9 years ago. So let's hear from Mary Catherine about how her journey was as a caregiver and a family member, and what were the challenges.
Great, thank you. I'm Mary Catherine Petermann, and my dad was diagnosed with anaplastic thyroid cancer in October of 2006, so 9 years ago this month. When we first got the diagnosis, it was devastating, to say the least, confusing and sad, and you're scared and not sure exactly what to do. We went through a series of tests and scans and biopsies, and the first doctors that we went to had never seen anaplastic thyroid cancer before, said that the statistics are grim, you're probably looking at 6 months. So we went to another facility, and we met with another round of doctors there who said that it was growing so aggressively and large and just really nasty that you were probably looking at 2 to 4 weeks for him to even live, and maybe we shouldn't even consider doing treatment. So we didn't like that answer either, and so we went to a third facility, ultimately ended up, by good luck and fortune and everything else, at Mayo Clinic, and with Dr. Smallridge and Dr. McIver kind of guiding us through that process, and working with them was phenomenal. Just the team of doctors that they got on the case immediately, between endocrinology and oncology and radiation, all together just in a matter of a couple of days. And a couple of days can literally make the difference between life or death in a situation like this. One thing, the radiation doctor that we had met with, Dr. Coe, he was leaving for a conference on that weekend, and we arrived on a Friday afternoon, and he could have said, well, great, we'll set up a meeting at the end of next week when I get back. And he spent that weekend like, okay, hold on, I'm gonna get through this, I promise.
So how long the treatment lasted?
So the treatment itself lasted about 7 weeks. That included both radiation once a day, 5 days a week, and chemotherapy once a week for 3 weeks. And the treatment itself is hard, and it's scary, and you hear all these horror stories about chemo and radiation, and you read about, it's literally burning you inside and out, and it's really, it's a really aggressive treatment that it has to be for such an aggressive cancer.
Thank you, Mary Catherine, for walking us through really incredibly difficult journey, but I'm so glad that it's all worth it and that your daddy's doing great.
Yes.
9 years down the road.
So hello, my name is Steve Sherman. I'm a thyroid cancer specialist. I have had many roles in the American Thyroid Association in development and in guidelines development. And I also take care of patients with thyroid cancer every day of the week. So what we've seen in earlier parts of this video is the challenge of being diagnosed with anaplastic thyroid cancer, what the impact is on patients, on families, and how difficult it sometimes can be to find the best care, to find the specialists, to find the physicians who can provide care. We've gotten a sense of the need for new and effective treatments, treatments that will make a difference in improving the lives of patients, and hopefully treatments that will cure this disease. We've seen the difficulty in finding the specialists who have the expertise to take care of this very rare, this very uncommon condition. And the American Thyroid Association is dedicated to improving the lives of patients with thyroid cancer. It is dedicated, it is working to try to develop uniform approaches that can be provided throughout the country so that we can focus on eliminating anaplastic thyroid cancer in the US and around the world. Through the development of guidelines efforts, the guidelines of the American Thyroid Association for anaplastic thyroid cancer, we have made major strides in moving forward towards developing a uniform, highest quality, best standard of care for patients with anaplastic cancer. Through this effort, the ATA depends upon the generosity of patients, of families, of donors to support these kinds of efforts. Support the efforts in research, support the efforts in guidelines development, support the efforts in the education of physicians everywhere. These donations can be made to the ATA through multiple vehicles. Easiest might be the website, www.thyroid.org, or by phone or by mail. But these are opportunities to help to support the American Thyroid Association in its mission, which includes a broad effort to try to attack and defeat thyroid cancer throughout the nation.